here today with Grace Worland. Grace is a nurse practitioner with the Rocky Mountain MS Center at the University of Colorado. She completed her Bachelor of Science in Nursing at the Denver College of Nursing in 2014. She completed a Master of Science in Nursing with the University of Colorado, Colorado Springs in 2020, and holds certification as an adult and geriatric nurse practitioner. Grace has been working with the Rocky Mountain MS Center since 2022. Has a patient-centered approach and is passionate about patient education, patient empowerment, and patient advocacy. Thanks for being here today, Grace.
Thanks for having me here, Kelsey.
Absolutely. So we're going to talk about fatigue today.
Yeah.
Keep it under 10 minutes. Let's start with what is fatigue?
Yeah. So fatigue is an overwhelming feeling of just malaise, exhaustion, poor motivation. It's more than just being a little tired. It is profoundly unable to do things because of the lack of energy.
So what are some of the causes of it?
Yeah. So the interesting thing is there are a lot of things that go into fatigue for our multiple sclerosis patients. And some of them aren't necessarily multiple sclerosis related. We know that neuroinflammation can actually cause fatigue in the brain. We also know that other conditions can trigger that fatigue. So things like sleep disorders, kind of like things like sleep apnea, central sleep apnea, periodic limb movement disorders can affect their sleep. We know that anxiety and depression, which unfortunately are also very common with multiple sclerosis, can lead to fatigue because it just takes the body a lot more to be able to function. We know that, comorbid conditions, so things like heart disease, other autoimmune diseases, obesity, joint disease, all of those things can also contribute to fatigue. And so it's definitely something that we see. We also see that oftentimes hormone changes, especially for women in the perimenopausal period, can experience significant fatigue. A lot of the medications that we use for our patients with multiple sclerosis can cause fatigue. So medications like baclofen for a muscle relaxer, gabapentin, other pain medications will often cause fatigue. So certainly trying to see if there's a way to optimize these medications in some way, looking at that risk benefit ratio, knowing they can certainly cause some fatigue, but if we can try to manage pain and muscle spasm with a little bit less medication, that may benefit your overall energy level.
Or I've heard of patients too timing their medications so that they're not causing fatigue during the day.
Yeah.
It's not always a question of take this or don't take this. There's a lot of room for to kind of play around.
Absolutely. Absolutely. And, depending upon when a patient is most symptomatic, sometimes we can adjust those medications so that they're taking them more in the evening at bedtime, those types of things to avoid that increased sleepiness during the day.
So I'm hearing there's kind of some primary, MS can be a primary cause of fatigue, but also there's a lot of secondary reasons. So if a patient with MS is experiencing fatigue, how can they talk about it with their provider? What questions should they be bringing up?
Yeah, absolutely. So I think it is important to bring it up first off. I think a lot of people tend to wait until it's really, really bothersome because they feel like this is just something that is par for the course. Um, but I think it is important to bring it up because there are a lot of things that we can look for. Initially, we can draw some blood work and make sure there's no underlying disease, things like anemia or thyroid disease. We can sometimes see vitamin deficiencies that can lead to fatigue. Sometimes we'll actually diagnose a patient with diabetes mellitus or something along that line too, that is which can be one of those comorbid conditions that can lead to fatigue. So be able to have that conversation with your provider and being open for the possibility of testing that can be done. We often will recommend things like a sleep study to evaluate for those disordered sleep patterns that can really strongly affect your sleep. Um, We often will look at things like what other experiences are you having? What other diseases do you have? How are things, the basics like your diet and your exercise? We know that, especially patients with chronic disease do better when they're exercising regularly. It really does help your body run more efficiently, and can help with that fatigue as well.
That's what you mean by exercise. Are you suggesting
Yes.
a
Good call.
physical fitness routine, or is this something people can break up throughout the day?
Yes, it can be absolutely broken up throughout the day. So, especially initially, breaking up your physical activity to 10-minute segments is going to be beneficial. It will take some time to work up to being able to do a session of like, 30, 40 minutes sounds like a lot when you're just starting that type of exercise. And it doesn't have to be, going to the gym and getting on the treadmill for, however much time. It could be start with walking around the block, start by, finding something that you enjoy doing, whether it's, something like dance, whether it's swim, any of those things can be very beneficial. Just getting your body moving.
And I think that's a really interesting one because it's kind of counterintuitive. If I'm not feeling
Yeah.
energetic, moving more seems difficult, but you're saying that could be helpful.
Absolutely. And sometimes if that feels like a mountain, to get past, ask your provider for a referral for physical therapy. Sometimes I'll start a patient with physical therapy because it can help to improve your basic strength. It can help to improve your basic balance and just give you some ideas going forward of some things that you can do to feel more confident in moving your body. The other thing that I do recommend for my patients is, um, to see a psychiatrist and a psychologist. It's important to do so regularly because the things that can affect your ability to sleep well and sometimes can really affect your symptoms as a whole is mental health. So things like depression, anxiety can really add to fatigue and other symptoms from multiple sclerosis. And, we know that living with MS can be hard. Sometimes it's going to affect things in different ways for different patients, and it's important to address all of those. So, as we know, sleep is very important. And obviously, many of our patients still feel fatigued even with appropriate sleep. That said, we often go through phases in our life where sleep is challenging for whatever reason. And that can be, again, that anxiety, that depression, those hormone changes, anything that's affecting your normal sleep patterns will make you feel more fatigued. So, doing things like, you know, looking at that sleep hygiene. Is your room dark? Is your bedroom used only for sleep and for sex and nothing else? Right? Like, are we actually doing those things to set us up for success? Um, so that you're actually getting that quality of sleep and ideally 7 to 8 hours. I think at least looking at that amount. If you're not getting that amount, I think it's worth exploring more reasons as to why and what we could do to help, even if it's something that you feel like you've dealt with forever.
And are there any medications that can help with fatigue?
Yes. So we do often use stimulant medicines for our patients. So medications like Adderall or Provigil or Mantidine. Sometimes these medications can really help with improving your level of fatigue and your ability to get life done. It's something that we recommend on a patient by patient basis. It's a good conversation to have with your provider to see if you could be a good candidate for one of these medicines.
So, what about involving your support partners or those around you to help understand your experience of fatigue?
Absolutely. I think it's very important. And especially, we are doing life with our partners, we are raising children, we are taking care of a household. It's very important to make sure you have that communication and maybe even a plan in place for those days when you do feel fatigued more so than others. And there may be days where, all of the therapies in the world and all the sleep in the world just is not helpful. And those are days when your body's trying to tell you that you need to rest, and that's okay. So having that plan in place Learning to kind of read your own signals a little bit can be beneficial in assessing how to move forward with plans that you may have for the day. Do you need to do those plans? Can they be moved to another day? Or how else to manage the other responsibilities in your life with that person? But
So what I'm hearing is it's important to bring up any issues of fatigue with your provider and to have an honest conversation with them about the other things going on in your life so that we can explore kind of all the avenues that might be contributing. And I'm also hearing that there's a wide range of solutions, all the way from some lifestyle things to possibly some medications.
yep, absolutely. And making sure too that you're including your other providers in that process as well. So whether it's your MS provider, your primary care provider, and addressing your overall health um, is very important.
Thank you, Grace, for
You're
sharing your
welcome.
expertise with us today.
Not a problem.